So, welcome to Reclaiming Vitality. I'm doing this video series dedicated to helping high achieving women break free from burnout and rediscover their energy, their confidence, and joy. I am Dr. Anna Lowe. I am a integrative functional medicine specialist. I'm a family doctor, high performance coach. And this video series is designed for professional leaders, entrepreneurs, we're ready to take charge of your health and thrive in all areas of life. So today I have a wonderful guest, Dr. Miranda Naylor, and she is a dear person I've met, a great colleague, mentor, educator, and I am excited to share with you her views and her insights as a women's health specialist. She is a doctor of osteopathy, and she's trained in functional medicine, and she specializes in fertility and women's health. So welcome, Dr. Miranda Naylor.
Thanks for having me. So happy to be here.
Yeah. So will you take a moment and share with us a little bit about who you are and how you got called into this profession and this work?
Yeah. Well, like you said, I'm an osteopathic doctor. I am family medicine trained as well. And in residency training, in a very intense residency, I was looking at our system that we had for taking care of people, and I was really seeing a huge gap there. I think so many of us in medicine who go into integrative and functional medicine, we see this big gap where we're, having sort of a mill of people coming through the hospital system, getting more and more pharmaceutical medications and not getting any better. They're actually getting worse. And they really are missing that vitality, that health that we know is possible. And so I saw this big gap in that we were not talking about Medicaid, or we're not talking about diet. We're really just prescribing these medications. And I was finding myself really dissatisfied. And especially when it came to women's health. At that point in my life, I was thinking about having a baby and I was coming off of birth control. And I was trying to navigate that, and I felt really alone in that process. I realized that my medical training wasn't helping me with that. I went to doctors and they weren't giving me any more information that I was really looking for. And so again, I saw this big gap, and was thinking to myself, how can I fill in this gap for myself, for my patients? And that's where functional medicine came in, where I learned about functional medicine and saw that this was a way that we can really help people better. We can actually support them in feeling well, optimizing their health, and really do things through diet, through lifestyle, and really achieve that vitality that we all want. We have like that good energy and have it balanced hormones and really feel our best, and ideally prevent illness from coming up in the future. So that's where my journey really started in diving into this. Again, I was sort of like selfishly motivated by my own health journey, but also it was really driving me to like find these solutions for my patients as well. And that's where I got into fertility in particular, and then women's health in general, and really solving these hormone mysteries that are not being addressed appropriately in the conventional system.
It is true. I think we are always our first patient, oftentimes,
Mhm.
and also the first, the best case study, because we're also really are fighting for ourselves. We really get to have a magnified view of truly the underlying motivation too.
Mhm.
What really stood out for me too is that, just like many other functional medicine doctor or holistic practitioners, it's often going from the reactive health approach to the proactive. Now I use words like we're now ready to optimize it. We're now ready to do it the better way versus
Mhm.
just not knowing what's next, or not knowing how to do it, or not being given the best kind of tools or clues how to do it in the first place. So yeah.
Yeah, absolutely. Yeah, the conventional system is great when you get into a car accident or you have a heart attack. It's going to save your life. Absolutely. But the whole system is geared towards illness. And nowadays, we're not just trying not to die, we're trying to actually feel well and feel our best in our quality of life. So that's where exactly we're optimizing and really trying to help support people in their lifestyle.
I love that. I think that, for a lot of the people who are my audience, they are already in that optimizing. They already know they're smart, they're already doing a lot of research, and they're already feeling they've done all the right things, but they want more.
Mhm.
Do you have, if you just think about in the last year and the last couple of years, do you have a story, that you can share from your patient experience as a doctor that kind of showcase a transformation, that just really excited you, that really just demonstrated like this, the work we do is really impactful and does change lives.
Yeah, absolutely. I mean, I have many, many stories like that, not to just like blow smoke, but I'm so blessed to be able to hear from people every day. Like yesterday, I had a full day of patients and everyone was having these wins, and I was just like so excited. One I guess I'll share is one of the more maybe like sort of extreme cases, and I actually just followed up with her this morning as well. Um, was a 32-year-old who came in feeling exhausted, not really sure what was going on. Her symptoms were sort of vague, like a lot of symptoms that a lot of us could have, just feeling like she couldn't exercise well. She was just feeling off. And we did her testing, and her thyroid hormones were off the charts, like outrageously high. She was basically in Hashimoto's, a really extreme case. A lot of her blood work was really just completely abnormal, and her hormones were tanked. Basically, she was in like early menopause, or premature ovarian insufficiency. And this is one of my favorite cases to really highlight the point of getting testing is so important, because otherwise again, her symptoms were sort of vague. They could have looked like anyone else. And she was literally in a thyroid emergency. And her hormones were just so bottomed out that she really, really needed help. And I don't know what would have happened if she hadn't come to me when she did. And again, I just followed up with her today. She's doing great. She's thriving. We do have her on hormone replacement. Like it's not like she's just doing this on her own, but she's really feeling great now. And there are always things that we're navigating. But it was definitely one of my favorite cases recently to show that like there can be such a big transformation that happens, and if you're doing things in the right way and really getting the right support, that you can just absolutely have an incredible outcome.
Yeah, you're absolutely correct. I think that testing is the best and fastest way for you to decrease noise and just
Mhm.
trying things and getting and also not get overwhelmed. I think changing our health, changing our lifestyle is a lot of hard work. And to be distracted by all these unnecessary steps without testing actually adds to that burden and adds to that extra work and pressure. And I think that when we test, we're actually getting them the fastest path forward. So yeah, great,
Absolutely.
great highlight for sure. Um, what do you see now in the last year? I think it's interesting. I've been in practice now for 15 years. Um, I think women's health has changed, right? There's different fads, there's different interests, there's different like symptoms that are showing more as we become as I think patients become more educated about different symptoms.
Mhm.
What are you seeing in 2024 as the most common health concern that our typical women patients actually face today?
Yeah. Nowadays, what I'm seeing is a lot of heightened PMS and mood instability around the cycle. We like to talk about hormone imbalance. It's such a like buzzword that a lot of people don't really know what it means. But hormone imbalance in the sense of really like losing touch sort of with our cycle and with our normal patterns. I think that's a big part of it, where we're doing a lot and we're depleting ourselves, and then we're developing a hormone imbalance that really usually shows up like low energy, feeling fatigued, feeling irritable. That's something that I see all the time. I think especially after the pandemic too, we're seeing a lot more burnout and nervous system dysregulation, where a lot of people are stuck in sort of a fight or flight place, and they don't know how to get back into the parasympathetic, get calmed down again. So that's kind of really the biggest things that I see nowadays.
Yeah, yeah. Well, I think I think where your specialty is around fertility, the hormone imbalance really lead to a very specific
Mhm.
lack of outcome, right? Or
Mhm.
outcome or lack of outcome. Who I see often are emotional and physical burnout. So they are in that emotional place where there's anxiety, insomnia, overwhelm, fatigue, and but they don't necessarily recognize they have that problem until they have a desire, and that's kind of, and they're stuck, and that's when they come see you.
Yeah.
um do we have decided on the topic of intermittent fasting, or just talking about fasting as kind of something that's been going on, or a very popular topic for a lot of burned out women, but also women who are kind of what you describe hormone imbalance. So
Mhm.
I'd love to kind of get your view, and maybe have you just start talking a little bit about what are you seeing out there, um, from patients who are coming to you who are having these symptoms, and what are people doing that is, caught maybe doing right or maybe not doing right. And what are some of your, you know, tips on approaching it?
Yeah, absolutely. Yeah, I mean, fasting is definitely a very hot topic nowadays, and there are a lot of benefits from it. And I think that's why it is so popular because people are at the place of trying to optimize their health. And in doing that, we're all getting into like biohacking, where we're trying to optimize, we're trying to put positive stress on our body to become stronger, to become better. And so I think that's why it's become so popular. It does have benefits as far as, improving insulin sensitivity, which regulates our blood sugar, can help with weight loss, reduce inflammation. It can help our cells function better as far as, mitochondrial turnover, really getting our cells to be functioning more optimally. There can be a lot of benefits there. What are the downsides, especially for women, is that unfortunately it's just not studied very much in women in particular, and even in humans in general. A lot of studies are done in rats or mice, and they're not even done in humans a lot of the time. And so we're talking about these benefits, but they're not actually in the population that includes us. And that's where it's really hard, especially when we are a menstruating female. We don't we're in a different environment and we have different hormones that are fluctuating differently, and we can absolutely disrupt those by doing something like fasting. So I really caution people with it, especially again women who are trying to get pregnant or who are trying to improve their fertility or trying to improve hormonal imbalances. They really want to be very careful with how they fast, when they fast, if at all, so they're not disrupting things and making things worse than better.
Yeah. So, I mean, I'm going to jump right into it. I think every
Hmm.
woman, when you think about why they fast, is because they want to lose weight. Right.
Hmm.
So, and especially, I think that interestingly, right, weight is one of the reasons that actually holds back successful fertility if they are, if they're obese, or they are, overweight. And so, what would you say, how would we start, right? How would you usually recommend the patient who comes to see you to start if they want to lose weight? How does, start with that? And also what is the role then of fasting in that case?
Yeah. So yeah, weight is a very common reason why people are fasting, right? Whether dieting in general, they're looking for a solution to try to lose weight. And you're absolutely right. Weight can be an issue on both sides of the spectrum for fertility, if our weight is too high or if our weight is too low. Um, so that can be a factor. And in certain situations, fasting could be a tool that people can use to lose weight if they need to improve their insulin sensitivity, which can be a factor with infertility as well. And so that can be a good tool. The problem, though, again, is that we can be disrupting our hormones while we're doing that. And so it's a very fine balance that needs to happen. And so in those cases, I really want to encourage people to, like, we're talking about testing, get the right support to know if and when it's the right tool for them to use. Because it isn't across the board a good tool. For example, PCOS is a syndrome where we have insulin sensitivity or insulin resistance possibly. Women with PCOS tend to be overweight, kind of the classic case, not all of them by any means. And so sometimes it's generalized. Women with PCOS would benefit from fasting. They can absolutely lose weight this way. And in reality, it isn't always the case. Some of those women, many of those women have high cortisol, have high stress hormones, or adrenal dysfunction, where their stress response system is just not in good balance. And so putting extra stress on their system could actually make things a lot worse than better. So it's always a case by case basis that I'm looking at for like fasting for weight loss. There are also other tools that we can use. It
I
looks like in evidence, I was just going to say for weight loss with intermittent fasting, it looks like it's calorie reduction that's really causing the weight loss largely. And so that's something that can be navigated without fasting also, or there are ways to do that in a more healthy, balanced way so that we're not bringing all the risks with the benefits.
Yeah, yeah, you brought up two very good points. That's why I wanted to ask the question, right? You
Mhm.
brought into hormones, cortisol, right? There are just certain things testing actually really refine whether you're a candidate for it. What would you say are some key hormones or some key tests that actually patients would benefit when they are looking into fasting to see if they are actually a good fit for fasting?
Yeah. Well, I recommend doing a full hormone panel, which for me would include DHEAS, testosterone, DHT, estradiol, progesterone, pregnenolone. Am I missing anything? Cortisol, for the stress hormones, along with a full panel to look at really everything else, like looking at metabolic health, insulin resistance, inflammation, all of those pieces, so they can see, okay, is their system really taxed? Is it already overstressed? Is it really inflamed? Do they have, an imbalance in hormones that would respond appropriately or not to fasting? For example, fasting, I kind of alluded to some of the downfalls that can come with it. A fairly recent study in 2022 showed that in women, both premenopausal and postmenopausal, DHEA was lowered, which can be detrimental to a lot of women, especially as we age and we're trying to conceive. DHEA is really important for egg quality, as well as just like longevity in general. It's really important for our hormone levels as well. So lowering DHEA could be a problem for a lot of women, but some women are high in androgens and DHEA, and that could possibly be beneficial for some women. So testing those can be really important to navigate, what each of us need and what would really benefit best from.
Yeah. And I think for my burnout, right, patients and audience, cortisol can do so much
Mhm.
damage. And also like they could be, you can have as much of a caloric restriction, but if your body thinks that you're in fight or flight,
Mhm.
there's no way it's going to try to release weight. It's going to try to hold on as if you're in famine, and it's
Yeah.
just trying to survive, and you're actually fighting this like internal battle
Mhm.
that sometimes without that clear holistic view that you're describing, it's really hard to um, really do it with ease and do it with the fastest outcome that we talked about again, as possible.
Absolutely. Yeah, I'm always having the conversation with people. I like to describe it as our body having just like one stress intake system, where whether it is mental, emotional stress, whether it's stress on our body from toxins or, not getting a good night of sleep, or even good stresses like fasting, like cold plunges and, exercise. Those are good stresses, hormetic stresses that strengthen our body. But if our body is in a place that's already overtaxed with stress, it can be too much. So especially if we're in that burnout state, then you're absolutely right. We're not going to let go of weight because our body is in this like holding pattern. And what it really needs is to actually sort of like lean into some of these things that we feel like we need to pull back from. So absolutely, we don't want to be stressing our body more if we're already in a stress state.
Yeah, yeah.
Can totally image.
So if someone, I'm trying to think if we want to be in a party setting or if someone coming to you, let's just say you are in a setting where, it's just the general population, people that you come across, maybe not in your office space, and they are like, hey, I'm just interested in fasting. What would be your top tips to kind of right? Without going in, without saying you're going to do lab tests, like what is just a general smart, middle of the road, safe, but just smart tips that you would give someone thinking about fasting?
Yeah, great question. I always tell people to start small. Don't all of a sudden go for this, like, I'm going to eat in just 4 hours and that's it. It's going to be too much for your body. It's going to be too big of far of a leap. So I'd always start slow, maybe start with a 12-hour fast, which is basically, say you eat dinner at 7 p.m., you eat breakfast at 7 a.m. Very doable for most people. It allows proper digestion. It allows a fasting state. It can help with some of those things without overtaxing your body and really feeling like a big stress. So that's a great starting place for most people. For women who are menstruating, really being mindful about what their body needs in certain phases, and really trying to keep their intuition strong. We've sort of, in our culture nowadays, our intuition is sort of shut down. And so really tuning into that. Okay, what do I need? Is this really the best time for me? I generally recommend avoiding any sort of fasting in the luteal phase, which is around ovulation through your period. In the follicular phase, especially if you're feeling really good, your energy is high, then those are times where you could get away with doing a little bit more. And that goes with exercise too. Like you can do things that are a little bit more strenuous and your body has a little bit more capacity to handle that. Around ovulation in our luteal phase, we're a lot more sensitive to stress. And so it's just not the best time in general.
Will you
Um,
clarify if
mhm,
someone has a 28-day cycle, follicular
mhm.
day one is the first day of your period. What would you say is the follicular phase, and what would you say is the luteal phase?
Yeah. So the follicular phase exactly would be from the start of your period, basically. Well, some people call that the menstrual phase. And so when you're done with your period, the follicular phase starts. Technically, they kind of overlap. So from, yeah, day one of your cycle, from the first day of full bleeding through ovulation. For the classic 28-day cycle, which not everyone has, but sort of an average, that would be about day 14. It is variable though. Day 10 to day 16 is really normal. So usually around there. And then the luteal phase is again from ovulation through the period start.
Yeah, no,
Yeah.
that's really helpful. Um, what's something to absolutely not do during fasting?
Great question. So for one, we talked about this population of like women who are like burnt out and just feeling super depleted. Maybe they're really stressed out. I just don't recommend adding a lot of stress on top of that. So I wouldn't fast if you're in that place in life. Um, I wouldn't jump in, like I was kind of mentioning earlier, jump into this extreme fast. I wouldn't bypass your hunger cues and just push through and bulldoze, even though you're feeling like crap. That is usually a recipe for disaster. So definitely wouldn't do any of those. Again, going more gentle, easing into things. While sometimes we're like, we really want big results. We think we need to do something really big and really extreme. More is not better when it comes to this. And so really wanting to be a little bit more
Yeah, there's
gentle
a
and
couple
easy with
things.
ourselves. Mhm.
I've learned in my journey is actually there is a lot of people, because dieting is such a common culture, that they've come already yo-yoing their diet. They've already gotten used to not eating a lot, and then they would have extra, and then just so the brain signals are not necessarily in a steady state. So it's almost like you have to pre fasting state where you actually make sure you're eating regular meals. Your body actually thinks that you're not in fight or flight or famine. And your body thinks, okay, you're actually in a good place to lose weight when you have fasting happening. And so having people not actually be on a period of just, you know, caloric restrictions or fasting before we start, like kind of really understanding that they haven't been starving their body, before we even start. I think that's one of the things I have to learn the hard way. It's like, well, why is nothing changing? And realizing turns out they've been just, starving their body, or and we have the clues of the thyroid and all the hormones, right? Is
Mhm.
that they actually do not start out doing well or balanced in the first place.
Yeah, I know that's such an important point. And that's one of the things that I'm really weary about too, is that we have this restrictive culture. And when it comes to diet, we're so quick to jump on the bandwagon to restrict further in our diet, but we're losing touch with what our body really needs. And we can have this yo-yo of really not knowing what to eat, feeling stressed about when to eat, what to eat. It makes it very complicated. And our body can have all those mixed signals of not knowing what's going on. And so you're right. Like if we're always doing something, then that too can be too much. Really getting into a steady state of even having regular meals. It's boring, it's not exciting or sexy, but eating 3 square meals a day and having, maybe a little longer fasting period overnight, eating dinner a little bit earlier, not eating right before bed, that alone is great. That's what our body should be able to do. And we should be able to get from meal to meal, feeling great, having steady energy, not crashing. That alone, as again, as boring as that sounds, that allows for metabolic resilience, still can allow for insulin sensitivity, all those things we talked about earlier, without being so extreme. And then, yeah, once someone is in a steady state and things are more balanced, then they could maybe push things a little bit further. Maybe they could get away with a little prolonged fast here and there, and maybe they would get benefits from it then.
Yeah, what you're describing, and when life is steady, we're thriving. And when we're thriving,
Hmm.
that's when we are prolific, we're fertile, we're able to, actually be more active and do different things or be
Hmm.
more cognitively present, right? We're not sourcing our, energy for survival.
Right. Yeah. And it's so hard when we're in that state. We want to just jump ahead and be like, why can't I just do those things? I need to show up at work. I need to be doing my HIIT classes. I need to be doing like these things. I want to look a certain way. I want to perform a certain way. And it's so hard because we actually have to, yeah, pull back and actually get to a good resting state, allow our body to be in balance. And then we can go back to, okay, now I'm going to thrive. And now I'm really going to be able to hit those goals and everything in a more balanced way.
Yeah, yeah. Well, you started off by saying that you are selfishly doing all this for your own benefit. So what would you say is your top non-negotiable health habits to keep you, right, be in this being an amazing, business owner, entrepreneur, fabulous doctor, and educator? Um, what is your habits?
Yeah. For me, I definitely can get my insulin and my blood sugars can be an issue if I'm not taking care of them. So for me, protein, which is another hot topic, protein's a non-negotiable for me. I have to start my morning with protein. I can't even start with a bite of like a waffle or something like that, even if it's a healthy one. I've just learned that won't set me up for my day appropriately. So good protein intake, steady meals, those are absolutely my non-negotiables. Good sleep is also like, do not try to mess with my sleep or I will, you'll see another side of me basically. Like sleep is so important. I've just learned that, absolutely. Um, and just having regular movement. I have some flexibility in my schedule and things like that that allow me like, and I've been able to schedule certain things to have, time outdoors, time with my kids, try to have some fun and good movement. Those are non-negotiables, even though they're flexible and in flux, which is important for me to be able to not have a super rigid schedule too. Yeah, those are my big things.
Yeah, that's really amazing. And right, like I think um like we've been saying, it's boring, it's steady, but it's actually really the foundation that
Mhm.
allows for our body to thrive and for our hormones to do what it needs to do.
Yeah.
It's the same for me, like last night, there was a light that was like not covered, and I was like, I woke up in the middle of the night, I'm like, where's this light coming from, like, because even
Yep.
just being a little bit more of that awake state, how it shifts, it shifts our energy, it
Yep.
shifts our circadian cycle. So
Mhm.
um
Love it. I'm the same
yeah,
way.
yeah,
Get all the light out of here. If I'm staying in a hotel or something, I'm like,
oh
what is
yeah.
that little light on that machine? Whatever. Yeah. So,
Yes. Well, and then I think as women go through the different cycles, the perfect temperature, right? The perfect
mhm.
the clothing, the perfect, that keeps you cool. And I think
Mhm.
I think also what we're really describing is there's a personal awareness of what we truly need for our body. And we get to then decorate it with the flavor that is really fitting for us.
Mm-hmm.
Right. And it's different. Like for you, it's like, you know, exactly the protein and that perfect insulin balance. Like I think everyone has their own individual need. And
Mm-hmm.
it's really about finding a day-to-day habit that supports that as they become educated by, experts like yourself. You know, let me
Yeah.
say, I always end all my session. We're coming to an end. This has been really, really amazing. Um, I ask everybody, if you could give one piece of advice to your younger self, to your 20-year-old self about health or wellness or life balance, what would it be?
That's a great question. I would say, and this kind of goes aligned with what we were just talking about, is just like trust yourself, listen to yourself. Don't give up that insight that you have. Because I think we get all this external information and we think, oh, like, oh, I need to be doing this XYZ, what someone else is doing. And for some reason, sometimes we trust external sources more than ourselves. And in reality, that's been like probably my biggest health learning lesson is just like listen to what my body needs, listen to myself. Um, even from day to day, things keep changing. And so just tuning in, learning in to tune in and really trust that, I think is the biggest, hardest lesson that I've learned. And so I think that's a good tool for all of us to continue
Yeah.
to
No,
really
that's a very, very valuable lesson. So I know you have a wonderful Instagram, platform that you share a lot of great tips. Would you like to share a little bit of how people can hear and learn more from your tips and your practice? What's what your social media handle that so people can follow you?
Yeah. Yeah. So on Instagram, Facebook, and TikTok, which I'm not super strong on, is Dr. Miranda Naylor. So DrMirandaNaylor. My website is drmirandanaylor.com. So they're all similar, so easy to find. And like you said, I'm located in California. So I see patients throughout California. And I love, yeah, being on social media and just sharing tidbits and good tips and having conversations that I think we should all be having about how to really best support our health.
Yeah, yeah. And so for those who are looking for more support around fertility, you're right. And please, look her up and learn more from her. Thank you so much for your time today. We learned so much, and it is so fun to just speak with another like-minded practitioner and fellow family medicine doctor and holistic practitioner to go through this journey and share this with our in our world. So thank you.
Yeah, my pleasure. Thank you, Dr. Lowe.
Yeah.